Now here's the new model for precision hormone clarity. Hi, I'm Dr. Eldred Taylor, the leading expert on hormone clarity. And thank you for joining me in this educational series on hormone physiology and testing. Now, if you've watched the previous videos, you've already seen how gaps in our training, not a lack of intelligence or dedication, have created decades of confusion around hormone care. Today, I want to show you the new physiology-centered model that allows clinicians to stop guessing and start seeing clear patterns in their patients. Now, in training, most of us were taught measure hormones in the blood, and that tells you the whole story. Now, to be honest with you, when I was doing my OBGYN residency, we never drew blood levels because we knew blood levels did not give us any clinically useful information. And that quote is in the GYN endocrinology textbook. But now we know that blood reflects transport, not action. Most hormone in the blood is bound and not bioavailable, and we knew that. But a lot of people on the internet, they don't understand that. The estrogen-progesterone relationship is not visible in serum. Cortisol's impact on ovulation is not detectable in serum. Menopausal estrogen from adipose tissue is invisible in serum. So this leads to normal labs, persistent symptoms, and increasing frustration for clinicians and the patients. The problem is not the clinician. The problem is that the testing method does not match the physiology. So this is a physiology-centered model. Here is the core principle. Hormones exert their effects in tissue, so the most meaningful data is the hormone fraction that enters the tissue. Saliva testing measures the free bioavailable fraction, the portion that has left the circulation and is interacting with the cells. The estrogen-progesterone balance is at the tissue level, not at the blood level. The functional impact of cortisol. When you measure the same part of physiology the tissue sees, everything becomes clear. That's when the patterns emerge, the symptoms line up, and clinical decisions become more straightforward. So here's the real source of provider frustration. The clinicians I teach often say, I'm trying to help these patients, but nothing adds up. And they describe normal labs and abnormal symptoms, repeated medication changes, cycling through different therapies, feeling unsure about the next step. This contributes to the burnout, the uncertainty, and the therapeutic stagnation. But when we use tools that show tissue levels, physiology, the confusion disappears. Now, the Taylor method means returning to physiology. Hey, look, my method is not new. It's not alternative. It's not a trend. It is simply classical physiology leading to pattern recognition, leading to precision adjustments of hormones. Now, this foundation, I quote Spiroff, I quote Guyton, all these are endocrinology books. And the actual endocrinology book, 25 years of observing thousands of patients in my practice. There is nothing mysterious about hormonal care when we follow physiology like it's supposed to be followed. So many clinicians today want clear frameworks, reliable pattern recognition, tools that match real physiology, language for explaining hormones to patients, a way to reduce guesswork and increase confidence. That's why I created a professional pathway that teaches the 3 core hormone patterns, how to interpret tissue level data, how to connect tests to physiology, and how to educate patients without overstating claims, how cortisol alters ovarian signaling, how menopause shifts hormonal sources. It's a framework clinicians can immediately integrate into their practice. So, what happens when you use a tissue-based model? Just think. When clinicians apply this method, they report faster diagnostic clarity, improved patient understanding, fewer repeated labs, less therapeutic trial and error, more consistent outcomes, because once you understand what the tissue sees, the rest of the picture becomes obvious. So I want to invite you to learn more. If you're a clinician who wants deeper education, if you want to learn these patterns, if you want to really understand physiology, advanced physiology, and advanced physiology is actually very simple. If you want to learn hormone interpretation, clinician-only case studies is what I'll be providing, and practical application. I offer a dedicated professional pathway called Beyond the White Coat. And if you found value in this series and want structured physiology-centered training, you're welcome to learn more. You can reach out to me directly through ViewMedi or find my professional contact information linked below. Thank you for your commitment to clarity in women's health, and I am Dr. Eldred Taylor.